from people is that they're interested in these talks, but they're just not coming at the right sort of time for them. So often they might be having to catch up on them at a different time, so we can share the link to the talk in future. Okay, I think we're quite an intimate group today, so do pipe up if you have any questions at any point. Please do feel free to join in. You're very welcome to unmute yourself and do it that way, or you know, if your preference is to type something in, Chessie will monitor that as well. I guess the focus, as to say on this first slide, is about having difficult conversations, and what I'm going to be thinking about today is how we have conversations with people who might be patients, who might be family members, who might be other colleagues. So this presentation isn't necessarily aimed at clinical staff, it's aimed at everybody. So there may be people who want to take some of the ideas from this presentation who work in a non-clinical setting, for example, but want to think about how they might support colleagues who are experiencing distress. I guess we're going to be thinking about a range of listening skills, which I think will, some may well be very familiar to you, but we'll revisit them, and some may feel quite new. What we know from research into listening and having difficult conversations is that actually staff who say that they feel skilled in communicating at work are actually those who also report lower levels of burnout and those who report higher job satisfaction. So I hope that some of the feeling that you have a skill set that helps you to support colleagues and patients in distress and so on may be useful for you in your working life. And we also know that this can be helpful for the patients and families that we care for, in that actually one of the main reasons for complaints in the hospital is associated with poor communication. So hopefully thinking about some of these skills today might have a range of different benefits. What I want to do is not only present the kinds of listening skills that we might use when responding to distress, but also give you a structure to hang them on, so that you can pull them to mind at times when you're having those kinds of conversations. So a real structure for your listening, because what we also know is that when people are distressed, if there's some structure given to the way that they're heard, then that can help them structure their thinking and can help them make sense of the experiences that they're having. So I'm hoping that you'll leave today with a bit of a sense of how to structure your listening when you're talking to someone who is distressed. I guess before we dive in, what I am keen to think about is when you're talking to patients, talking to family members, or talking to colleagues who are distressed, just think for a moment about what are the sort of conversations that you find difficult, and reflect for a moment about what topics might it be hard to talk about, or what feelings might it be hard to witness. And you don't need to necessarily share these with us if that doesn't feel right, but just spend a moment just thinking about, are there particular areas that it can be tough, or particular feelings it can be hard to see. And I guess it's worth asking in that context, are those difficulties linked to our own life experiences? Are they linked to a fear of what might be shared or how we might manage a conversation? And often in our busy working lives, are they linked to a concern about how we might end the conversation appropriately? Often what people might say is the unpredictability of a conversation when we're busy can make it quite difficult to know whether it's appropriate to start that conversation. What we don't want to do is to leave someone distressed and uncontained and need to head off and get on with something else. And so I guess it's that proverbial can of worms that I think we're probably all familiar with that saying, in terms of what is it that we're opening up when we start to talk with another person. With that in mind, I wonder if this cartoon kind of rings any vague bells with people. Stop eating, stop overeating, stop drinking, stop staying out late, stop fighting, stop worrying, stop eating sweets, stop gambling. And what did the doctor say? I don't know, I stopped listening. And I guess what I'm trying to highlight here with this cartoon is that desire that we all have to make stuff better. Actually, as health professionals, we have a real wealth of knowledge. about a person's physical condition, about how our colleagues might be managing different situations and so on. And that is combined with a desire to help people to get better and a desire to help people cope. And what that can lead us to fall into is the trap called the righting reflex, where when somebody shows distress, what we try to do as a kind of reflex response is to make that distress better, to take that distress away. And I guess what today is going to be about is why that might not be the most helpful course of action for us to take. So just to sort of unpack the righting reflex a bit, it's that urge to offer our experience and knowledge and ensure that people feel okay. And what it can lead us to do is to give advice or to offer reassurance or information. And both of those things, they're not bad things to do, but what it can lead us to do is to offer those things too early in a conversation. We're keen to share what we know, we're keen to support somebody, and we can dive in too quickly. When we're working clinically, it can mean that we only ask about physical symptoms and perhaps avoid some of the emotional symptoms associated with them. So a classic one might be a patient saying, I'm just so anxious, I just can't get to sleep. And actually what we can find ourselves doing is focusing on the difficulty with sleeping, focusing on the environment and what we can do to support the environment changes, focusing on pain, and all those things are very, very important and necessary to do when someone's struggling with sleep. But what we've skipped over is the I'm so anxious part of that experience that the person's sharing with us. I guess it's just about highlighting that as well. We can also ask leading questions because we've often heard many of these issues before, and that can lead us to kind of, I guess, make assumptions quite quickly about what we think may be the concerns a person has. And we can ask too many closed questions, those yes/no ones that only lead us in a certain direction. And we can fall into the chit chat and personal disclosure, which I think can sometimes, I don't know how many of you work at a bedside and so on. I think some of that is so important in terms of putting a patient at ease. But it's important also to get a balance of that in terms of staying curious and finding out with somebody what concerns they might have. And my own personal bugbear is mopping up tears. I think this is something that I see an awful lot where somebody is becoming distressed about something difficult and they're starting to cry, and a natural response in that situation is to reach for tissues. And all I would say is, I don't know if you'd agree with this, Chessie, but my sense is actually if you can pause for a moment and allow that person to shed some tears, what you're showing there is I can tolerate this distress. It's okay to show this level of distress. If you rush very quickly to grab tissues, what you're saying is mop this up, clean this away. And I'm not saying you wait until someone's got snot drooling down their face and they're kind of, overwhelmed with the whole thing, but actually just allowing that bit of space for someone to cry is acknowledging that crying is okay and can be tolerated and you can manage that. So that's something that I would also recommend.
And I think, I was sorry, go on. Totally agree. I think that if it's possible to wait, I think that can be a real sign that it's okay that someone's crying and they don't need to stop. But also I know that the urge to get tissues, it's kind of a sign of caring, I think, in a way. So it's about balancing that, as you say, May, and maybe just pausing before you get them, even though it feels like it's a gesture of caring, obviously, which it is. But yeah.
And I think with all of the above, what we know is that as soon as you start to do those things, you're reducing the likelihood of further disclosure. So we know that actually disclosure is normally preceded by silence or just very minimal comments. So it's just worth bearing that in mind. So just thinking about why we jump in to fix it. As we've already covered, it's that desire to make it better. It's the fact that we're often busy and a conversation can be quite unpredictable and we fear it might become lengthy. We've got that big to-do list to get through. And also, sometimes we're very good at starting those conversations, at saying to someone, I notice you seem a bit upset today, but we're anxious about how we then end it. And I hope today to just give you a few skills in terms of how you can end those conversations you know, even if it is about acknowledging them and being able to come back to them at another time. So what I hope we'll do is we'll think a bit about some listening skills, and we'll also have that structure, as I mentioned, for you to hang those listening skills onto. I guess a key message in this regard is that active listening is not the same as waiting to speak. So most people don't listen with the intent to understand, they listen with the intent to reply. And what I mean here is that while someone's talking, often what we're doing is we're formulating our response, and this is how we get to the to and fro of conversation. And absolutely that makes sense, but sometimes if we're busy formulating our response, what we're not doing is properly listening to the person. So it's just worth bearing that in mind and just thinking about some of the things we do when we're actively listening. Some of these are going to feel barn door obvious, I realise, but they're worth kind of emphasising. It's important to look at the speaker, and it's important to notice when you're distracted and bring your attention back. Notice and show how you're listening. So particularly at the moment, if we're having to wear PPE, you know, those nods of the head and open posture and small verbal comments are all the more important to demonstrate that you're listening. And as I said before, you know, stay curious, don't make assumptions about what you think the issues are going to be. So all these things are really important, and crucially what they're not about is they're not about problem solving with the person just yet. They're not about making judgments about what may or may not be useful for the person, and they're not about giving advice. They're just about being available and truly trying to listen to what it is that the person's trying to communicate to you. One way that you can support that listening is through paraphrasing. So this is simply restating the same information that someone's given you with different words. And what that allows the person to do is hear what they've been saying and start to make sense of it. So you might use summary terms like "it sounds like you're saying," or "I noticed that when you say this, perhaps this is happening," or "when you say X, I'm wondering whether this." And again, we're not problem solving, making judgments or giving advice. So to give you an example of that, someone might say, a family member, for example, "I don't understand why he can't be in a hospital nearer home. It would make everything so much simpler." And a way of paraphrasing that back to the person might be, "I see, it's unclear why he's still at the John Radcliffe, particularly when it's so far away from where you live." So you've not added new information there particularly, you've just given them a paraphrase of what they've said that allows them to hear their thoughts back and helps them to formulate the issues that are coming up for them. It's a really powerful tool to use when you're listening to someone. And another approach that you can take in terms of active listening is about reflecting. So this is about using a statement and not asking a question, but making a statement which acknowledges how someone is feeling or acknowledges the perspective that they might be taking. So it enables a person to feel understood. This is about empathy, and it affirms and validates their position. And what we're trying to do here is keep the person thinking and keep the conversation moving. And it doesn't matter if actually the guesses that we're making in terms of how they might be feeling are correct. That's okay. What we're doing is we're making a guess, and actually people are very good at correcting us if we get it wrong. So just to give you some examples, if someone were to say to your patient, for example, say, "I'm fed up of being in hospital," a simple way of reflecting this might be to reflect the perspective.
Oh, I think we might have lost you, May. Are you still here, May? Oh, I think you're back now, May. We lost you
now.
Yeah, sorry. We lost you just very briefly when you got to this slide, reflective listening.
Okay, I've lost the slides now. Hang on.
Do you want me to share them on my screen?
If you've got them handy, that would be really helpful. Hang on, I don't want that in the... I've had so many connectivity issues today. Sorry about this. I might stop sharing and start sharing again and see if that helps. Can you see that?
Yeah, you're back. Yeah.
Okay. Sorry, guys.
Are you there, May? I think we've lost you again.
And I guess, and what you, I'm really sorry. I am back again.
You're back now. We can hear you again.
Okay. Can you see that?
I can see that. Yeah, we can see that.
Thanks so much, Jessie. And so I think I was talking about reflecting a feeling. So the person said, I'm fed up of being in hospital, and you might say to them, it's frustrating. And like I said, it's okay if actually the person says, actually, do you know what? I'm really feeling really lonely right now because I'm just not getting to see my family. And so you've not necessarily hit on the right feeling at that point, but what you've done is given the person the opportunity to correct you and to share what they think is going on for them at that point, and you've moved the conversation forward. So we've talked a bit about how we actively listen and paraphrase, and the idea of using reflections as well. And also a really important role that we can all take is in normalizing. So this is reassuring, but it's different from reassurance, because what it does is it keeps the conversation going. It doesn't close it up. So we might say, we often find in the first few days, for example, I work in major trauma. Someone might say I'm having nightmares, and I might say we often find in the first few days that patients tell us that they experience nightmares about what happened. And just putting that phrase in front just gives people a sense of actually what I'm experiencing right now is quite typical and quite normal for people who are going through what I've been through. Or families often share that they experience, etc., etc. It's not unusual. We know that. Given you've experienced a road traffic collision, it's not surprising, or it's understandable that you're feeling X, Y, Z. So all of those things can be very reassuring to a person because they normalise their experience. But they're quite different from the kind of reassurance we might use in everyday conversation, where we might say, oh gosh, I know how you feel, or you'll get over it, or you'll be fine, it's not as bad as you think, things can only get better. And all of these things, I think we need to be mindful, particularly, I think, say, for example, with patients who have been through a very difficult period with COVID but have survived and are doing well. I think that message that they are lucky could well be one of those reassuring messages that we're wanting to give, but actually, and may for some people exactly hit the nail on the head of how they're feeling, but for others could feel quite removed from where they're at and not reassuring for them. So just trying to use that general language about what's often noticed, what we often find, what's not unusual can help to normalise somebody's experiences. Those, I guess, are the main listening skills that I wanted to introduce or reintroduce you to, because I'm sure you'll have come across them in other parts of your work. But I want to give you a kind of step-by-step guide, really, a structure in terms of how you can hang those together and how you can use those. And I guess the first thing to be mindful of is that people who are worried or people who are upset often don't know if or when they can share their views. And so the important thing for us to be doing is to notice that there might be something going on for someone. And we don't necessarily need to push at that point. It may not be the right time for that person to be talking or the right setting, but we can let somebody know that we have done that noticing, and that can open up the conversation. Better language cues that people might use that might indicate to us that perhaps there is an issue that they're experiencing. So, like I mentioned before, a physical symptom that reflects a psychological state is someone reporting sleep disturbance that isn't necessarily directly pain or environment related, but might be anxiety related. Or speaking to a colleague, for example, checking in with someone who's shielding and how's it going? Oh, I manage. Is just kind of vague enough that maybe it's worth checking a little bit further and seeing whether there's anything going on for that person. And again, suggesting where people might be suggesting concerns in their response to you. How have things been over the last few weeks? Oh, it's not been easy. you know, it's taken a while to get used to X or Y. And there's kind of neutral expressions that don't really give you very much information. You know, I don't know how I'm feeling, or, you know, I'm getting along, or all of those things might just be just an indicator that it's worth just checking in a little bit further. And what we want you to do in terms of checking in is to start just by gathering information. So to avoid that writing reflex that I talked about earlier, because we know so much stuff about how we can support people, but let's just hold off on throwing in that advice at this point, and let's just really listen. So this is kind of, I guess, a bit of a step-by-step guide about how we might structure our listening, and Chessie is kindly going to help me with this in terms of, this is just a scenario that I've put together about a member of staff who may be working in critical care, and I apologise for any blatant inaccuracies in terms of things that go on in critical care. That's my error, but I hope the gist of the listening process might nevertheless be useful for you. It's worth bearing in mind that the first things that people mention may not be related to the problem particularly. People don't necessarily always say all their concerns immediately. So it's worth asking, and it's worth asking again what concerns people might have. And it's also worth listening out for those things that you can't fix, because it's okay and it's helpful for people to have those listened to as well. Okay. So this first part of this step-by-step guide is about gathering the information, and overall what we're doing here is we're asking someone what's going on for them. So I notice you seem upset, what's troubling you? And then we're asking again, and is there something else? And what we know is often if we say is there something else rather than is there anything else, we tend to get a bit more information from people. So it can be worth just a little shift in language when you're talking to someone. And then we're pulling back on those listening skills that I mentioned before. We're summarising and normalising the experience, and we keep kind of bringing in those summaries each time. So Chessie, if you've got the little mini script that I wrote for us. This is going to seem a bit wooden because we're being scripted, but I just thought it might be a nice way of just demonstrating this. So I'm going to say to Chessie, you know, I notice you seem upset. Can I ask what's troubling you?
The ward round was just so busy today, and one of the doctors asked me about the blood results for bed 4. I didn't have the answer to hand, and I normally would. I guess I just felt really on the spot and couldn't think straight.
So what I'm going to do now is I'm going to summarise and reflect the emotional state I think Chessie's experiencing. So the ward round was pressured and you weren't able to feed back in the way you usually do. I can see that might have felt stressful. Is there something else?
I guess I'm looking after more patients than usual. I'm just finding it really impossible to get through all the things I normally would. I feel so hot on the ward, and then the PPE means everything's taking so much longer.
It sounds exhausting working in full PPE. It means it takes longer to complete tasks. On top of that, you're expected to cover more beds.
Yeah, I wish I could just have more time with each patient. I used to like getting to know them, getting to know their families, really having a sense of what mattered to them.
I see. It's making such a difference not being able to nurse in the way you normally would. And with visitors not allowed, it's understandable that impacts on how well you can get to know patients and their families. Is there something else?
I think that's it. It just all feels too much.
So we've gathered information there, and in my mind, I've got a list of concerns. Chessie's had a difficult ward round. She's looking after more patients than usual. She's not able to get through all the tasks. She's struggling with PPE, and she's missing out on not knowing her patients well. So I'm going to do a bit of a summary of all of that for Chessie. So it feels overwhelming right now. It's a lot to be dealing with. If I understand you correctly, the ward round felt stressful, and you weren't able to contribute in the way you normally would. With COVID, you aren't able to get to know your patients how you'd like, and you're expected to look after higher numbers. It's a struggle to get through all the necessary tasks, and PPE makes the work uncomfortable and all the more challenging. So what we've done there is we've found out a bit about what's going on for Chessie, okay? We're still not diving in with advice or suggestions or judgments. We're holding off on that, okay? And what we're doing is we're recognising that actually people have got their own ideas about what might help, and people have also got their own ideas about who might help. We happen to be here at this point in time, but that doesn't necessarily mean that we're the best person to help them with this. We just need to help them with their thinking. So we're holding off on sharing our story and our experience and how difficult we've found it on the ward and how difficult we've found PPE, and we're holding off on giving advice. We're just going to find out from Chessie what she knows. So we're going to ask about her support. Has she got anyone who's able to support her? Ask about what ideas she's had. And only then, so it's point 6 of 7, only then we're going to ask about what we can do. So Chessie, just to go back into role for a moment. So who's able to support you with this at the moment?
Well, Natasha the matron's very good, and John the physio's helping too.
So Natasha and John are being helpful. Are there any other people able to help just now?
I mean, I talk to my husband when I get home.
Okay, I see. So tell me, how does Natasha help? And I will.
Oh, you've gone out again slightly, May. Are you there, May? Just wait a moment for May to come back.
I'm so sorry, everyone. I am now back. What a nightmare. I'm going to stop sharing and then share again, and hopefully where did I get cut off, Chessie?
Just at the point where we finished and you were asking me how certain people help.
Okay, so essentially what I would do is I would go through how Natasha helps, how John helps, how her husband helps. And then we'd move on to thinking about what ideas Chessie has that she thinks might be helpful. So again, in role, Chessie, so you're being asked to take on more patients than usual, and the COVID situation means you're not having the opportunity to get to know them and their families in the depth you'd like. The PPE is hot and exhausting, and it's stressful at ward rounds when you don't feel as prepared as you'd like to be. What do you think would help?
Well, it would help if I could stick with the same 3 patients, and I need to properly unwind in my break time. I find I'm mentally making lists of things I need to do rather than relaxing.
Okay. And so I'd summarise that, and then I'd say, what else?
I guess it would help if Natasha was there for the ward rounds as well and could maybe look up some of the information I didn't have at my fingertips.
I see. So sticking with familiar patients and having someone join you on ward rounds would be helpful. And given the pressures of working in PPE, it sounds like making sure you can find a way to switch off in your break periods would be useful too. So we've gathered information, we've asked about support, and we've asked about how that support is helpful, and we've asked Chessie what she thinks is useful. And it's only at this point that we're thinking about how we can help. And is there anything I can do, Chessie?
Yeah, I know some of the patients' families have been making photo boards and family trees for them. I don't have the chance to speak directly to families, but seeing those pictures would really help me have a better sense of who I'm nursing.
Okay, yeah, I mean, perhaps I can ask the families if they're interested in creating one next time we speak. So what I'd do then is think about, and it would only be at that point that I might offer other ideas that I had that might be new to Chessie, that might not be part of the thinking that she's already come up with, or the ideas that she's already come up with, and where I'd bring in my own experience and thoughts about what might be useful. And then finally, we'd move on to summarising the whole thing. And people tend to pick up when you do this that you're ending the conversation. People recognise that, we've done this, we've talked about this, you've identified these things, and I'm going to go away and I'm going to do this. And that's a nice way of kind of encapsulating that and being able to say, and it sounds like there's still more that we need to talk about, and maybe we can come back and talk about it later because I recognise you're busy at the moment, or I need to head off and do this. And people can feel quite contained by having that summary at the end and an acknowledgement of what's going to happen next. And that's, I guess, one way of kind of containing that kind of worms that we talked about before. So just to summarise what we've talked about today, Active listening is about being curious. It's about showing you're listening, so nodding, and obviously when we're wearing masks, that nodding needs to be more exaggerated, and it's about holding that open posture. Remembering to paraphrase, which initially I think can feel like quite a strange thing to do, and possibly felt a little bit stilted in the scripted conversation we just had. But when you do it with somebody, people don't tend to actually notice they're being paraphrased. They're hearing their own thoughts and ideas back, and actually that can help them structure their thinking. Reflecting and empathizing, and remembering what I said, that doesn't have to be right, it just has to be your best guess, and it's just about moving the conversation on. People will hear that and they will correct you if it's not right, or they'll say yes, that's exactly it, and they'll carry on and they'll add more to the conversation. And then also importantly, normalizing what they're going through. Given that this is all happening, it really isn't surprising that you're feeling this, or that that's happening, or the ward rounds are stressful, and so on. And then bringing it all in for a summary, and then talking about what's going to happen next is one way of kind of rounding up the conversation. So this is just the summary, and it looks like quite a lot, you know, ask, paraphrase, empathize, ask again, summarize, ask about support. But essentially, the overarching thing you're doing is really keeping an open mind to find out what it is that's going on for this person, and asking them again to get more information, summarizing that, finding out who's around that can help and how, what ideas the person has, and then finishing off by suggesting your own ideas and how you can help, and summarising the whole thing. So that's kind of the structure to hang on that sort of that way of actively listening to somebody who's in distress. And I hope it's one that's kind of memorable enough that you can pull on it when you're having those sorts of conversations with colleagues, with families and patients and so on. I'm going to stop screen sharing, and I'm going to dare to attempt to turn my camera on, and hopefully won't get kicked out if I do that. Am I here?
Yeah.
Hello. I don't know if anything came up in the chat while I was talking at all, Chessie, or if anyone has any questions at all now.
Nothing in the chat at the moment.
Any thoughts from anyone? Is this kind of feel a relatively new way of holding these kinds of conversations, or what are people's thoughts about it?
We've got something in the chat. Someone said a good refresher, and someone else, very useful for me as an administrator.
Mm-hmm. I think a lot of the listening skills that we've probably all kind of come across at some certain points in our training and things. I just wonder what people think about that structure as a way of organising those kind of conversations, and whether that feels useful for people.
Another message on the chat just to say, sometimes I get worried, spouses ringing and wanting to talk. I can use a lot of this for phone conversations. I think that's a really good point in terms of, I think it can almost, I know I can get a bit tied into what should I be saying, whereas I think this is a nice way of recognising it's not your responsibility to say all the right things, it's about listening. Someone else has said it's been really helpful to receive some guidance, as it's not something that's usually offered or made easily accessible or known about.
Mm-hmm.
Janet saying she's not got a mic, and then Sarah, yeah, it was useful to have some structure, thank you.
And is there any part of it that's, I won't keep us all for long if there's not lots of questions and things, but is there any part of it that doesn't feel clear or that you'd like me to go over again?
Got another message saying it's easy to jump into giving advice and it's nice to know that we don't need to do this. I think that's a really good point. I think it's almost instinct to want to give advice.
Yeah, and I think sometimes that can impact on how, like, I think I've said this already, but it can impact on how we listen, because I know I'm guilty of it. As somebody is telling me their distress, I am formulating in my mind how we're going to work through this, how we're going to resolve this, and thinking about things that's reminding me of other people who've experienced similar. All of that's going on in my head, and actually what that's doing is getting in the way of really listening to what this person is bringing at that point. And so it really is about holding off at that point and just staying curious. Just stay curious and reflect what you're hearing. You're just helping someone through that thinking process. And I would say, if ever you're stuck with what to say, summarize. It's just such a useful skill to have, you know, and it can help move your thinking on as well. So if somebody's come up with a number of issues that they're experiencing and you're thinking, oh goodness, this feels overwhelming, there's so much going on for this person, actually summarizing them back to them can then lead you to think about what next question you want to ask, or what's missing from what you know, what doesn't quite fit together. So it's a really useful thing to use, and people, it doesn't feel artificial when you're doing it with people. People appreciate that structure being given to the conversation that they're having.
And I think for me, on lots of occasions when I've summarized something back, sometimes it's not quite what they meant, and that's a really good way of people clarifying, because I might say, oh, so it sounds like what you're saying is this, and they'll say not quite, or no, and sometimes you think, oh dear, I've got that wrong, are they going to think I've not been listening? But actually it gives them a chance to delve further into what it is they're saying. So and all it does is show that you're trying to understand, even if in that moment it's not exactly aligned with what they were saying. So I think it's a really good tool for getting conversations going a little further.
Yeah, absolutely. Okay.
I've put the feedback link, I'll paste it again just so it's at the bottom of the conversation. So there's the link for the feedback form for today's session. People are happy to fill that in, that'd be great.
Thank you. Apologies for the poor connection and keeping you in suspense occasionally. And thank you
very much.
Okay, thank you.
Thank you.
Right. Thank you.
Thanks very much. Bye.
Okay.
Bye.
Stop recording.